Still ahead, important news for parents. We're going to tell you about a common disorder in kids that's often misdiagnosed. We're going to explain what's happening to the little boy in this video when we come back. We all know how overwhelming autism can be for children and their families. And this 3-year-old boy appears like he might be a classic case. He has tantrums, he can't stand loud noises, he doesn't like to be held. But Jacob Turner is actually overwhelmed by an even more common problem. It's called sensory processing disorder, or SPD. Jacob's mother, Jennifer Turner, and Dr. Lucy Jane Miller, author of Sensational Kids, Hope and Help for Children with Sensory Processing Disorder, are both joining us now to give us some insight in this. And good morning to both of you.
Good morning. Good morning.
Dr. Miller, what is sensory processing disorder, and how many children suffer from it?
Sensory processing disorder is a difficulty perceiving sensation and then responding appropriately.
Jennifer, tell us a little bit about your son, the kinds of things that you started to notice, and the temper tantrums like the one that we've seen in this video.
He's always had some gross motor delays. Jacob is a sweet little boy, a little late to walk, a little late to talk, but as he got a little older, around the age 3, he started getting more uncomfortable in social settings. He started to become more uncomfortable with loud sounds and those types of things.
And what did you think that it was, Jennifer?
Well, at first I wasn't sure, but then the bells started going off around 3. I was thinking, this is not your average typical child. And so that's when I started doing a little research on the internet, and which led me to sensory processing disorder.
Dr. Miller, let's take a look at some of the symptoms here for parents to help them diagnose this perhaps in their child. We're going to take a look at some of the red flags for parents. And you say the first one is that the child doesn't like to be held. At what age might we see this manifest itself?
You could see this any age from infancy on up.
So this is something that could actually get worse as a child gets older then?
It might get worse if they're surrounded in a loud situation at preschool or something like that.
You say that a child might be bothered by background noise also and unexpected sounds. What about unexpected touch? Would that also fall into that category?
Absolutely, yes.
And you say the child's mouth is bothered by food, so that is something sensory. Maybe you might think that your child's a picky eater, but there might be something more serious going on?
That's exactly right. People say their children are fussy babies, picky eaters, or irritable and aggressive. In fact, some kids are actually taken out of preschool because they can't quote, behave well enough. But it's actually a sensory problem.
And the good news is that this can be treated, right, Dr. Miller?
That's correct.
And Jennifer, I know that Jacob's been in treatment for a couple of months. How's he doing?
He's doing wonderful. He has come so far. He's much happier, more confident, more comfortable with himself. And we've really come a long way thanks to Dr. Miller's help.
Well, I'm so happy for you for that. Jennifer Turner and Dr. Lucy Jane Miller, thanks. And again, we'll have more information on our website for any concerned parents out there. Thank you both.
Thank you.
Thank you.